Welcome back to
Allergy Actually.
Today we're talking about how to manage allergic rhinitis with over-the-counter medications. Last episode, you learned about things we can do to modify your environment if you suffer from pollen allergies, and today we're going to dive into medication options.
So I think one of the questions I get asked all the time is, which allergy tablet is the best?
I have a preference.
Okay, wait. Should we
tell you
all
what,
at the same time?
Say what our preference is.
Generic name?
Generic name.
Name.
Yeah, okay. After 3. 1, 2, 3.
Cetirizine. All right, so I pick Cetirizine because I find it's the most widely available. It's easy to find out there. You know, the time to onset of action is very similar to diphenhydramine, which is the one that's Benadryl. That's what people often, whenever they think, I have allergy symptoms, I need a Benadryl. And I'm like, no, don't use Benadryl. Zyrtec or Cetirizine will start working within the same time frame, and it lasts longer. And it's very cheap. And I will say the advantage of that over Fexofenadine is that you don't have...
Hey now.
I know, right? I know. I'm going to go ahead and pick on it. I'm already going over your... Is it a purple or pink pill now? I think it's maybe pink.
The box is purple, the pill is pink.
Okay, got it. Yeah, so
that's
mine's
not
just
why
a little
I
white
recommend
tablet.
it, but...
But I keep a warning, or I have my dot phrase has a warning that you shouldn't take it with grapefruit juice because of the CYP450 enzyme. And I'm sure no one really does that, but I have it on there. And
we're 40, not 80.
Right.
No offense, 80-year-olds, because we will be drinking
yeah,
grapefruit
we
juice.
will. Yeah. But that's always in my mind. But there are advantages of Fexofenadine that I will admit to. Oh, and also for Cetirizine, it's once daily dosing for children. Who has time for twice daily dosing?
Yeah.
Nobody.
I think where my hang up is I'm very sensitive to medication side effects. And so on the occasion that I have taken Cetirizine, I am out like a light. And that's how it is it's even more so even with half of a diphenhydramine. I'm, even feeling hungover the next morning. And so as someone who is more sensitive, we're kind of taught that it's about 1 in 10 people who will have some sedation, even though it is a less sedating option. But I do prefer the tablets are smaller. And frankly, I'm not great at swallowing pills. I mean, I do choke down my fish oil that I take, but...
Wait, which one did you say Cetirizine to?
No, I say Fexofenadine.
Oh, you said Fexofenadine. Okay.
Yeah, so...
It's 2 against 1.
Yeah, well, okay, so first let's lay the groundwork here. There are different types of antihistamines. So we're talking about H1 histamine blockers, the type that we mostly are targeting for treating environmental allergies. And there's first generation, things like diphenhydramine, or what most people know of as Benadryl. Then there's second generation. That's the Cetirizine, the Allegra, the Loratadine. And then there's a third generation, levocetirizine. Is Claritin also?
Desloratadine.
Yeah, Desloratadine.
Yeah, that's a third generation too.
Okay. So we're all talking about our favorites, which happen to be second generation antihistamines that are all supposed to be non-drowsy. But I agree with you, Kara. I do have quite a few patients that say they get drowsy with Zyrtec. Now, plenty of patients love Cetirizine. It works great. I do like that too. But I think the reason, if I was forced to pick a favorite, I would pick Fexofenadine is because it does not cross the blood-brain barrier as easily as Cetirizine. So there really should be no drowsiness with it. And I just feel like it works really well when if you're dealing with hives or swelling too. Like so many people with allergies have other things going on, and I just like that one. And the pill's pink and the box is purple.
It's pretty, right?
What do you like about it?
The less sedating aspect. I think that's the biggest reason that I've leaned towards that. I'm not a huge fan of the tablets being larger and the twice daily dosing for kiddos.
Yeah.
But it is what it is. And I will say
you can break them in half.
Yeah, and I'll say from the one we're leaving out of the conversation is Loratadine, which is also known as Claritin, and every once in a while, I have a patient that will tell me, gosh, I've tried Allegra. I've tried Zyrtec. Claritin is my jam. It is the one that works the best for me.
OGs love Claritin. It was the first.
That is true.
Yeah.
That is very true.
And I will say that is where, you could ask us all day our favorite, or, if we had to choose,
Right.
But at the end of the day, there is some individuality and some variation between each and every one of us and each and every one of our patients. And so I think that has to be recognized. If Claritin is your jam, well, heck, it is cheap, it is easily available, and it is a small tablet too.
100%.
Tablet.
Yeah, I actually recommend to patients, get one of them. I don't care which one. Start with the cheapest one. And then when you're out of that bottle, then pick a different one and work through
Compare.
the ones to compare.
Yeah.
See which one works best for you, because you may have just said this, Kara, but most people, Claritin or Loratadine is on the weaker side. And for some people, that's what they want. So that'd be a good choice.
Yeah.
But for 25% of people, it actually works better for them. So yeah, you don't know who you are, which one's best for you until you try them. So you kind of have to try them all.
That's why I always loved having samples in the office.
Yes.
When it was
Yes.
allowed. And now that I'm on my own and we'll have, be able to do that again. But
Yeah.
because it gets expensive to try, and if we're going to talk about where we can save money and where the best place to get them, but if you can get a little sample pack of 5, it gives you enough days to say, which might be my best fit.
Yep.
So for me, patients will say, when should I use my antihistamine? And I want to first say that I typically at that point sort of clarify with them, what are you taking it for? Because I always say antihistamines are good for itchy, watery, sneezy. If you have a lot of nasal congestion, you can take it, but typically we aren't going to treat the nasal congestion unless we have targeted direct nasal therapy.
And let's say congestion, stuffiness,
Yes.
and drainage.
Yes.
But especially the stuffiness or
Yes.
trouble getting air in and out.
Yep.
Absolutely.
Because I think that sometimes I didn't realize how some people congestion is the mucus or the snot or the boogers,
Good point.
and
Or
not the
it's chest
stuffiness.
and not nose. Yeah. So
Yeah.
we do have to be careful about that. So as far as moving on to some type of spray next, do we want to do that again where we say our favorite over-the-counter one?
Oh, I don't know if I can decide.
Oh, I have an absolute
You have
one,
a favorite?
hands down.
Yeah.
My problem,
Okay.
though, is I can't remember the second chemical for the generic name. So I think I'm going to have to say,
The brand name.
yeah,
Fluticasone Furoate,
is that for the...
Sensimist.
Yes,
Yeah.
that is. Okay. Well,
Okay.
Okay, it's ruined. I love that one.
1, 2, 3. Fluticasone.
Fluticasone Furoate. Yeah.
Furoate.
Yeah. And I have many reasons why I like that one the best. It is, so it actually used to be a different medication under a different brand and then was bought by another company and rebranded. And so it's over the counter. And I also have to tell my patients that typically if we send in a nose spray to insurance, they will sub out the other fluticasone propionate, which it's truly a different medication. And so what I tell patients, the difference is that the fluticasone furoate has a softer puff. Back when we did have drug reps who came around and sort of sold those types of things, they would say, look, and they would squeeze and have the old brand and they would show it, it would touch your hand and they would be like, look, it doesn't drip. And you're like, wow, indeed it doesn't drip. And so it doesn't go down your throat and it doesn't have any flavor. It doesn't smell like florally or, anything like that. And
It's a mist instead of a squirt.
absolutely.
Is that how you
And it
describe
can help with eye symptoms. That was one of the big things
Yep.
that in their FDA clinical trials, they looked at eye symptoms. So people who have allergic conjunctivitis, I really push using that for them.
Yeah, I found it much better tolerated in children. Trying to wrangle a nose spray into a kid is an alligator wrestling match at its easiest. So having something that is more gentle and doesn't smell or drip is huge.
I agree.
The actuator.
Yes, the actuator.
On the side is
It's kind of
actually...
like these, actually, on our microphones.
It is. But you squeeze it on the side. When I'm asking people, they're like, I use fluticasone. I'm like, do you pump up and down or do you do it to the side? And that's how I know which one they're actually using if they can't remember
Yes.
which or don't know the second, name and the chemical name. So Yeah.
So I think one of the other really important tips that we have to hit on is when do we use medications? When do we start them? And because everyone wants to minimize how much they take, right?
Yep.
We don't want to take if we don't need it.
So it kind of depends on when you're having symptoms. If you are one of those people that just has pollen allergy, you don't have allergies the rest of the year, then you can focus on, okay, when do I normally start having symptoms? So like in our part of the world, grass pollen starts pollinating in May-ish, usually May, June. So you want to think a couple weeks before that and start taking your medicine routinely before the season if you normally have a pretty bad allergy season, because then you get ahead of it. You have the medicine in your system and helps you feel good. But what about people who are like, well, I can manage it except for like a few days out of the season? What do you guys tell them?
A few things. I mean, sometimes I'll say, generally, and this is all for educational purposes and not direct medical advice.
Right.
Correct.
But it's reasonable to take a second antihistamine on a bad day. And although we see the most benefit from using the nose sprays on an everyday basis, if you're having a rough day, taking it that day isn't a total wash. You may still actually have some benefit. It's just you see the optimum benefit, especially in the stuffiness, if you're using it on a regular basis.
Yep.
That's a good point. One thing I like to tell people, I think holidays are easy to remember. And so I sort of group tree allergy and grass allergy together. And again, in our neck of the woods, trees start blooming typically March. It's getting a little earlier at the end of February, but I tell them start your medications on Valentine's Day.
Me too.
Right? Yeah.
I
and
love
then
your nose.
I say,
Like,
yeah,
super
yeah,
cheesy.
absolutely.
It's almost like we were trained at the same
It is
place.
almost like that. It is very shocking. And I say use that through the 4th of July, and then July you get a reprieve. And then if you're unlucky enough to also have grass allergy, or mold is an allergen that's present year round, but much worse in the fall, then I tell people to restart that. Usually at the 1st of August, but there's no holiday I could come up with at that time. But at least the Valentine's Day is there.
I agree with that. And I think for those of our patients that are on multiple medications, because there are many of them that are on an antihistamine, a nose spray, an eye drop, maybe an inhaler for asthma, if you're, in your season and you're doing really well on all those medications, but you're feeling like you don't want to have to be taking all those, just talk with your allergist or talk with your doctor, because maybe you can come up with a plan where you're on maybe 2 of the medicines routinely and you just add the other ones in. Or if you're on all of them all the time, certain times you can take a break, because our goal is to help you use as little medicine as possible. And also our goal is for you to feel great. So if that means you have to take your medicine routinely, do it. You deserve to feel great all the time.
And that leads us, I think, to our next episode, where we are going to talk about what we can do beyond medication for more lasting relief from environmental allergies. And thank you so much for joining us today. And please leave, you're better at saying this, in the show notes.
What do the
Yeah,
kids
well,
say? Just like,
Make sure
follow, subscribe.
like, follow,
Yes.
subscribe. Hit that bell.
Yeah.
No, but if you have ideas, suggestions on topics you want to hear us talk about, certainly there's some medications that we didn't have time to cover
there's a
today.
ton.
We want to hear from you. So leave those comments below.
So thank you for joining us today on
Allergy Actually.